There's two parts to a colonoscopy prep. The first part is actually staying on a clear liquid diet the entire day before. So anything that you can see through, I usually say, is something you can have. Jello, applesauce, Gatorade, coconut water. You can have that throughout the day. It's very important to stay hydrated. The second part would be the preparation that you would have to drink, and that would of course make you clean out the colon to make sure that we have no stool in the colon when we do the colonoscopy. There are multiple preparations for a colonoscopy. The one that we predominantly use in our office is actually all over the counter. It usually involves Gatorade or some sort of an electrolyte drink for hydrating, and also Miralax. It's an over-the-counter powder. You'll mix that powder in with that Gatorade and be required to drink a cup every 15 minutes or so. There are no suppositories or enemas with this one. There are a few other things that you do have to drink.
Colonoscopy preps are not fun. However, they're not nearly as bad as they used to be. Most of my patients who are now having their second or their third colonoscopy tell me, it wasn't fun, but it was nothing like it used to be. It's much easier than the preparations that they had performed before. We ask patients to have a low-fiber diet, eliminating seeds, nuts, and other non-digestibles in the week prior to the exam. The day prior to the exam, they should consume nothing but clear liquids like apple juice or white grape juice. The evening before the exam, they should consume a preparation liquid, and there are a whole host of agents out there. Colite or Gavolite, which are some of the older products, Prepapic, Miralax, and many other agents are available. It is important that the patient take some of the prep the evening before and another dose of the prep the morning of their exam. The reason that this is important is that when those doses are split, when the prep is divided, the examination of the right colon is much, much improved. The places where we think it is easiest to miss a colon polyp is in fact the upper parts of the colon, the right colon. And if the patient is able to clean that part of the colon out effectively, that makes for the most careful and complete exam.
There's a misperception about the colonoscopy prep. It's actually much better than it used to be many years ago. The preparations available now are much more palatable, they're not as bad tasting, and there is also a little less volume to drink, and it's more effective. The preparation does give some bloating and cramping because of course it will lead to multiple bowel movements. However, it's not painful. It is a little bit of an inconvenience to have to drink so much fluid in a short period of time. It is something that is effective in cleaning out the colon, so it is necessary.